6 clinical officers in Kenya have tested positive for COVID-19, union says. At least 6 clinical officers in Kenya have tested positive for COVID-19, according to their union. One doctor is also reportedly infected, according to unconfirmed reports from medics attending to patients. Kenya Union of Clinical Officers Secretary General George Gibbery has blamed this on the unavailability of surgical masks to prevent transmission as they come into close contact with patients. This follows reports of the rising number of health workers being infected with the virus. We have received confirmation on the cases of a clinical officer working for the Ministry of Health in Nairobi, a clinical officer in Ngara Clinic in Nairobi, a clinician stationed at the Kenya Ports Authority in Mombasa, 2 in Mombasa County's public health facilities and 1 in Baringo County, said Mr. George Gibbery. A survey carried out by the union shows that an estimated 7 out every 10 or 68% of health workers in Indiana public health facilities have not been trained on how to handle the COVID-19 pandemic. According to Mr. George, the survey on the working conditions and preparedness in the country's public, private and faith-based facilities was carried out between April 3 and 6, 2020. As a union, we conducted the survey to assess the working environment and preparedness to fight COVID-19 in the healthcare system. The survey involved 46 counties and the respondents were drawn from all cadres of healthcare service including doctors, nurses, laboratory technologists, among other frontline health workers, he said. Among the key findings of the survey was the lack of formal training on COVID-19 in at least 7 out of 10 health workers. A worrying finding was that 68.4% of workers have not been trained on how to put on and remove personal protective equipment, PPEs, while 58% do not know of the required PPEs available at their places of work, he said. He said the survey had established that up to 90% of the staff had received masks with 57% receiving gloves. Commenting on the shortage of masks and gloves, Mr. George said the trend had contributed to 6 of the union's members contracting COVID-19 while on duty. This trend of shortages is worrying considering that COVID-19 is mainly spread through droplets and aerosol-based infections. It poses a great risk of infection to health workers. No wonder we have at least 6 clinical officers confirmed with COVID-19, he said. Mr. George said almost 9 out of every 10 health facilities were not providing masks to patients with respiratory conditions, meaning they were doing little to prevent them from infecting others. From our findings, we have also discovered that 85% of the facilities are not giving patients with respiratory conditions face masks when they come for medical attention. A further 75% of the respondents reported their facilities as lacking a room or wing set aside for COVID-19 testing, said Mr. George. The survey also found that 68% of health staff were facing transport challenges due to the recently imposed curfew. He attributed this to lack of proper identification badges among an estimated 56% of health workers. The union wants the government to employ at least 2,000 clinical officers as the 500 to be recruited will translate into 10 per county, a number not even enough to address the shortage that was there before the pandemic. The union also urged the government to set up separate isolation facilities in all medical centers where patients with respiratory symptoms can be treated. They would also hold suspected coronavirus patients. In addition, the state should streamline the COVID-19 referral system to avoid relapses, hence ensure there are clinical psychologists attached to healthcare workers to ensure their psychological well-being, he said. They also want the government to waive all the pay-as-you-earn tax for health workers during the period of the outbreak to show appreciation of the risk they face. The world has so far recorded 1,700,007 coronavirus cases with 102,751 deaths and 376,529 have recovered. Kenya has so far confirmed 189 coronavirus cases. To prevent coronavirus, wash your hands frequently. Maintain social distancing. Avoid touching eyes, nose, and mouth. Practice respiratory hygiene. If you have fever, cough, and difficulty breathing, seek medical care early. Stay informed and follow advice given by your healthcare provider and your government. Subscribe to Kenyan News Today channel for latest updates.